Hello everyone, we'll be explaining how different body systems work together during jogging. We'll explore the anatomy and physiology involved, demonstrating a comparison of heart rates after exercise, discuss a medical condition, and introduce a medical device to diagnose this condition. Let's begin with the anatomy involved during jogging. Three main structures play important roles during this activity, which is the heart, lungs, and leg muscles. Heart pumps oxygenated blood throughout the body, supplying the working muscles with oxygen and nutrients. During jogging, the heart beats faster so it can deliver more oxygen to meet the body's increased demand. The lungs are responsible for taking in oxygen from the air. Inside the lungs are tiny air sacs called alveoli, where oxygen enters the bloodstream while carbon dioxide is removed from the body. Finally, the leg muscles, particularly the quadriceps and calf muscles, contract repeatedly to produce movement. These muscles rely on a continuous supply of oxygen to function efficiently throughout the exercise.
So now, let's look at what happens inside our body while we are jogging. So as physical begins, our breathing rate will increase, then it will allow more oxygen to enter the lungs. So in the alveoli, oxygen diffuses into the bloodstream while carbon dioxide moves into the lungs to be exhaled. So the heart then pumps the oxygen-rich blood to the working leg muscle through the circulatory system. So inside the muscle, oxygen is used to produce energy known as ATP, which allows the muscle to contract continuously and keep us moving. So this coordinate process between the respiratory and cardiovascular and muscular system enables us to perform physical activities such as jogging efficiently.
After completing our jogging activity, we measure our pulse manually at the wrist to compare our heart rates. As shown, my pulse rate was 98 beats per minute. After resting briefly, my reading returned to normal, and I did not experience any unusual symptoms. In comparison, my partner's pulse rate was 134 beats per minute. For this demonstration, my partner is acting out symptoms such as heavy breathing, excessive sweating, and fatigue to illustrate how a person with sinus tachycardia may appear. It is important to note that an increased heart rate immediately after exercise is a normal response. However, if a person experiences a persistently fast heart rate while resting or develops ongoing symptoms, further medical assessment is recommended.
So the condition demonstrated in our video is called sinus tachycardia. Sinus tachycardia occurs when the heart natural pacemaker knows at the signal alpha or SA node, so it will cause the heart to beat faster than normal. So a resting heart rate above 100 beats per minute is generally considered sinus tachycardia. So some symptoms include the palpitation, dizziness, fatigue, shortness of breath, and excessive sweating. So although these symptoms can sometimes occur after intense exercise, but they should not persist once the body has recovered. If they continue while resting or occur frequently, the medical attention should be sought to determine the underlying cause.
One of the main medical devices used to diagnose sinus tachycardia is the electrocardiogram or ECG. An ECG records the electrical activity of the heart using electrodes placed on the chest, arms, and legs. These electrical signals are displayed as waveforms, allowing healthcare professionals to assess the heart's rhythm and determine whether it is beating normally or abnormally fast. Because it provides accurate information about the heart's electrical activity, the ECG is one of the most reliable tools for diagnosing sinus tachycardia and other heart rhythm disorders.
So in conclusion, jogging is an excellent form of exercise that involves the cardiovascular, respiratory, and muscular system working together to provide oxygen and energy of movement. So while it's normal for your heart rate to increase during exercise, it is important to pay attention to warning signs such as persistent palpitations, dizziness, chest pain, or shortness of breath, especially if they occur while resting. So to maintain good cardiovascular health, so always remember to warm up before exercising, cool down afterwards, stay well hydrated, and exercise regularly. So most importantly, if you experience unusual or persistent symptoms, seek medical advice promptly, and early recognize and proper diagnosis can help prevent more serious complications. So thank you for watching.